Good morning friends, I'm Arun Maurya. Welcome in my channel Let HSC Learning Academy. So friend, today we are going to discuss occupational diseases and diseases related to occupation. As I have discussed previously about four types of occupational diseases, so we are going to continue on this topic. So the first one is arsenic related illness. Chronic exposure to arsenic in the occupational setting, skin lesions, and peripheral neuropathy are the most common adverse effects. Patchy hyperpigmentation is the classic skin lesion of chronic arsenic exposure. Other adverse effects include anemia, leukopenia, etc. and liver injuries we can also call. Arsenic exposure occurs when workers sand or burn this wood. Arsenic is used as an alloy in lead acid batteries. Inorganic arsenic is no longer used in agriculture in the United States. Organic arsenic pesticides like cacodylate acid, disodium methyl arsenate, and monosodium methyl arsenate are used on cotton. The high risk occupation at greatest risk of arsenic poisoning include the following. You can see here. The first one is applying arsenic preservatives to wood, manufacture of pesticides containing arsenic, and sowing or sanding arsenic treated wood, smelting or casting lead, smelting or refining of zinc or copper. This is all types of high risk occupation. The current OSHA permissible exposure limit for arsenic is 10 microgram per meter cube for 8 hours time weighted average. The NIOSH National Institute of Occupational Safety and Health 15-minute limit for arsenic is 2 microgram per meter cube. So the next one is berylliosis. This is also a occupational disease. Berylliosis is a lung disease resulting from the inhalation of beryllium. All compounds of beryllium should be considered potentially harmful if inhaled, even in minute quantities. The current OSHA permissible exposure limit for beryllium exposure is 2.0 microgram per meter cube for 8 hours TWA. It has a ceiling limit of 5 microgram per meter cube, not to be exceeded for more than 30 minutes, and never to exceed a limit of 25 microgram per meter cube. Beryllium is used in lightweight metals, especially in valves in the aeronautical and space industries. Chronic beryllium disease may occur among people who are exposed to the dust or fumes from beryllium metals, metal oxides, alloys, ceramics, or salts. It occurs when people inhale beryllium in these forms. CBT, chronic beryllium disease, usually has a very slow onset, and even very small amounts of exposure to beryllium can cause the disease in some people. Acute beryllium disease usually has a quick onset and has symptoms that resembles those pneumonia or bronchitis. The acute form of disease is believed to occur as a result of exposure well above the current permissible exposure limit. This form of beryllium disease is now rare. Recent data suggests that exposure to beryllium even at levels below the 2 microgram per meter cube PEL permissible exposure limit may have caused CBT in some workers. Therefore, employers should consider providing their beryllium exposed workers with air purifying respirator equipped with hundreds of series filters, either and PRR. Where appropriate, powered air purifying respirator equipment with HEPA filter, particularly in areas where material containing beryllium can become airborne. So the next one is copper related illness. The primary method of entry into the body for occupational copper exposure are through inhalation or absorption through the eyes or skin. Short-term exposure to copper fumes causes irritation of the eyes, nose and throat, and a flu-like illness called metal fume fever can result. Metal fume fever symptoms include fever, muscle aches, nausea, chills, dry throat, cough and weakness. It may also include a metallic or sweet taste in the mouth of the affected employee. Long-term exposure to copper fumes owing to repeated exposure may cause the skin and hair to change in color. The Occupational Safety and Health Administration OSHA permissible exposure limit for copper fumes is 0.1 mg per meter cube for 8 hours TWA. The OSHA PEL for copper dust and mist is 1.0 mg per meter cube. Initial medical screening for employees potentially exposed to copper should include a thorough history of chronic respiratory disease and Wilson diseases. So the next one is cadmium related illness. Acute exposure to cadmium can cause delay pulmonary edema and acute renal failure after inhalation of high concentration of the fume. Chronic exposure to cadmium dust and fume is toxic primarily to the kidney with secondary effects on the bones. Biological monitoring of cadmium exposed workers is mandated by OSHA to prevent chronic renal diseases. Studies have shown the latency period to be approximately 10 years. High-risk occupational exposure are due to the following, like brazing using cadmium-based solder, machining or welding on cadmium alloy or cadmium-plated steel, making cadmium-containing products, plating metal with cadmium, reclaiming scrap metals containing lead, cadmium, beryllium, and mercury. Removing cadmium coatings, smelting or casting lead, smelting or refining zinc and copper. The Occupational Safety and Health Administration permissible exposure limit for an 8-hour shift is 5 microgram per meter cube. The action level established by OSHA is 2.5 microgram per meter cube. You can also refer the standards for cadmium is 29 CFR 1910.1027. Thank you for watching. If you have any doubt, you can put your doubt in comment box. If you like my video, please subscribe and share my channel. Thank you for watching.